record. The recorded file will be converted when the meeting ends. Okay, so it's recording. Okay, perfect. Hello, Dr. Singh. Welcome back. I know we have spoken many times in the past. We come from the same town in India. Welcome to my show. You know, recently I started this show. It's called Improving the Business of Medicine with Kunal Jain. And I'm doing a video as well as an audio podcast. So this particular show today, because we did not plan it, and I know we work great without any planning. So today I'm just putting you on the spot without any planning, and so am I. And we are going to discuss some of the issues. You know, the key issues which were coming to me as someone who has been into healthcare for such a long time, but never been a part of clinical healthcare. And I was thinking about Obamacare and HIPAA and some of the tools and some of these ideas which were like thrown on us. And at some point we were thinking that they are the bottlenecks in the healthcare, or they provide they help into rendering a better healthcare. So this question comes to my mind as someone who is passionate about healthcare, not only from the business perspective, but as a clinical perspective also. So I wanted to talk to you about it. What do you think about this whole thing which is going on at this moment? Let's start the conversation.
Well, as you know, it's a very rapidly evolving situation. We have something that on a global scale, we are seeing a massive challenge to our paradigms, our healthcare systems, things that we had taken for granted. The health systems are being tested. Think of it like a stress test of our healthcare systems across the globe.
And that's a good one. Yeah.
And we are also seeing our leadership, how it's responding, how the rules are changing. In some ways, it's a good thing that they're adapting to the changes, but it's also confusing. So we have to constantly educate our patients, our staff, ourselves on how to treat this virus, how to help our providers stay safe while they take care of patients, how to protect each other from any of us and make sure that it's a community effort. It's not a one-sided or focused on one individual. It's about all of us. So we are in the same boat. We will all either sink together or sail together. So I think it's something that, you know, we became doctors because we wanted to do something to help and to heal, to serve. This is the time when we are being tested. And I never can say I hope for such a time, but this is the time when we have to stand up together and do our best. So right now, what you're doing, unplanned interview is where we are. We are doing telemedicine with our patients, trying to get used to this new world where we can communicate without needing to touch each other. Although I don't think that can be discounted. That's something we will probably always need for our sicker patients, and to touch with them, to engage them, to examine them. But it's something has been shifted. You know, the whole globe, the whole technology world that we used to see in a different way, now we're being forced to use it. You're seeing the changes in HIPAA. Immediately it has changed. You're seeing telemedicine that has come. You see everyone either jumping together or people quitting and getting scared. And we see that in the medical side. So it's a big opportunity to learn and grow. And as Churchill said, you know, a crisis should never be allowed to go waste. So we should use this crisis as an opportunity to become better, smarter, more compassionate, more careful, more deliberate. I know I'm saying a lot of things, but there are so many things happening at the same time.
I know, and it is happening with such a fast pace.
Yes.
And, you know, I know you manage, you know, a good amount of healthcare in your county, Pasco County, and you have thousands of patients and manage under several hundred physicians which take advice and guidance under your mentorship on pretty much daily basis. So I wanted to know what is their perspective, how they are responding, and you must be receiving hundreds of calls like now, because you have so many physicians attached to you and patients who are seeking healthcare. So other than canceling their appointments, where is the opportunity, or what do you see how they are responding?
So one thing we have seen is patients are very appreciative what we are trying to do. For the first time yesterday, I was thanked in Starbucks for doing what I do and given a free cup of coffee. I must say, people, I mean, it feels
People
good that you're being
understand it, yes.
appreciated. You know, doctors, we've been told that we have a very noble profession, but somehow over the years, our reputation started going down.
Yes.
But now I think we have reached another point where we are finally recognized for what we do in some way or the
You're
other.
talking about overall as physician community.
Yes, and even
Okay.
patients appreciate. But what we are doing is we are holding calls with our staff, with our doctors every day, bringing them up to speed. And now
what do you tell them? What do you tell them? Like
everything
1,
that
2,
is
3, like 5 things you tell to your physicians.
Yeah. So the most important things, right? And where we can have maximum impact. When so much is happening, you have to pick 4 or 5 things in your message that immediately should be done.
Correct.
So the most important message, for example, for today was to call patients what we call warm touch. Call our patients.
Warm touch. Very nice.
Make sure they're okay. If they need anything, any medicine, if they have any concerns, any medical issues. A lot of misinformation is there, right? People got overdosed with alcohol.
So you're suggesting the physician should have their girl or nurses reach out to the patient, or
no,
themselves.
our physicians
themselves should pick up a call and make calls to their
patients and just call all their patients like that. Yes, I called a patient myself. We had our first COVID positive patient in my service, my patient. So I called her, she appreciated, she's okay, she's at home. And fortunately, no. So then I have to contact everybody she has come in touch with that I know of. So that's a big challenge.
Right.
So that's what I've been doing.
So how do you find those patients?
You have to be like a sleuth, like a detective.
You're acting like a spy.
Family, vendors, staff. So the goal is to keep our staff safe so they don't infect others.
And is somebody from the government agency helping you out? Like if you do you have to report it to someone if you find a patient?
Department of Health. They've already reached out.
And they take care of all the investigations and rest of the administrative issues.
Yeah, the significant other is going to the Department of Health this morning. He has my phone number. He texts me anytime he needs me. So we are in constant touch. This is the time people are reaching out to me on Facebook. People are texting.
So no privacy anymore.
Privacy has gone down. People are asking for referrals on Facebook, and I just keep my mouth shut.
And now you cannot save or hide your personal phone numbers.
No, I never did. I always share with my patients.
Yes.
I always.
A patient knows about it. They have no problem. So I hear doctors all the time. They say, "Oh, we don't want to call. We call from private number. Or we hide our patient. We don't want our patients to reach out to us." They have like, what do you call it? Gatekeepers, like telephone companies who become their gatekeepers. So I think their business is going to go away. There would not be any gatekeepers in the healthcare anymore.
So I've never had a problem with patients calling me on my phone. They've always had my email. That empowers them. They don't abuse it. Our patients are, very respectful.
Right.
But this is the time. Call me, text me, whatever you need. So all our providers, I'm advising them to call patients, make sure they stay in touch. Whatever we can do for you, we are ready.
Fantastic. Oh my God. And what do you think, how's this, because I know we have been talking about Obamacare, and Obamacare was about to be repealed. And this is just with Trump had to do nothing, and this is all gone. No HIPAA anymore. No more copays, deductibles. Yesterday, I was hearing this news, Humana and Cigna, they both indicated they are not going to charge any copays and deductibles from their patients. And our president was greatly appreciating that thing. I know it was kind of marketing stunt, but some of these things are happening. How are you coping up with those changes which is happening into insurance side, and how are you telling or sharing it with your staff or physicians or patients? And so give us some ideas on that front.
So as far as possible, I know, HIPAA has kind of been put in abeyance right now. So as far as possible, we still like to honor their confidentiality, patients' confidentiality. But we are even calling them on our FaceTime. I mean, if they don't have access to the telemedicine apps and all, we are I'm calling them on my cell phone. So that is kind of gone out the window in this time of crisis. I think those courtesies can be put
And then
aside.
how do you manage billing for that? Then you have to, keep it in a separate,
Yeah,
log.
so we document it, and we don't know if we'll get paid for it or not, but we
You are
document it.
just just
That
providing and renting the
right now we
healthcare.
just
That's
want
it.
to survive. All of us just let's survive first, then we'll
Right.
think of billing.
Right.
So that's one. The sequestration, as you know, is going away from May 1.
Right.
So that'll be that funding for the Affordability Care Act will be gone.
Well, I
think
heard that they are not going to even, worry about MIPS and MECRA anymore as well. So it's
I
a part
think
of, so
yeah.
no incentives, no penalties.
Right.
It evens out.
Right. So I think the good, so Affordable Care Act had some good things in it. I think it had good intentions.
Right.
But the way it was set up was flawed on a flawed paradigm.
Correct.
They were charging physicians and insurances to pay for the care of the uninsured.
Right.
It's itself a flawed model. Those who are insured have to pay more for those who are uninsured.
Right.
It becomes unfair at some point because the premiums for the insured go up.
Right.
Physicians are getting paid less to take care of those who don't have insurance so that they can get paid more when they take care of the uninsured. It was kind of a strange premise. And they've lost focus on reducing costs, Part D costs, hospital costs. They lost focus on population medicine. How can we improve general health? How can we improve the quality of healthcare?
So all of this confusion and chaos is now going to go away.
Well, it's going to, I hope we have more wisdom
on fans for some time. But, I was wondering if you're going to practice this kind of behavior. So I know some people are going to be disciplined, but a lot of people and a lot of that disciplined behavior about this confidentiality and other things are going to go away. What challenges we are going to face as a community down the line, 6 months or 1 year? Are we seeing the complete radical shift into healthcare business, or it is at this moment indicating something else? So what do you think about this? How it is going to hold in future?
Well, I think telemedicine is here to stay.
Right.
I don't think they'll bring back sequestration unless there's a real overhaul of the Affordable Care Act. I think that was the goal. It has just happened this way. I think our whole healthcare approach will have to be challenged.
Right.
Whether the Affordable Care Act or Obamacare, as it's called, will stay is a moot point right now because it is not here right now. Whether it will go away completely is we don't know. But I think the trend is that trends are that probably will go away, but we don't know for sure. Will the ACOs stay? Will the bundled payment initiative stay? I think in some form they will stay. But if, let's see, I mean, we don't know. Every day things are changing. I think 3 to 6 months, it'll be kind of a reset. And then I'm sure both sides will negotiate with each other and try to figure out something. It will also depend on election results.
That is true. That is true. So this is fantastic. And now, one of the things telemedicine is doing is opening up the borders. So like, especially now the physicians doesn't have to have a license in other states to see patients. And I'm getting a lot of queries, even, the hospitals are trying to consolidate their patient database on their telemedicine model, where you can just have a virtual clinic. You don't have to have a real estate anymore. And in that virtual clinic, you can use your existing physicians and clinicians to render healthcare through telemedicine. So what is the percentage of patients who comes to primary care do you think are qualified to have a perfect healthcare rendered through telemedicine, or it is going to go away soon as well, because you really need to, as you mentioned, that you have to touch and feel the patient to provide the actual healthcare?
So, we have to risk stratify people who are sicker, who have, say, 3 or 4 medical issues, diabetes with vascular disease or cirrhosis or heart failure or COPD. I think you should still see them. Those are, so the way we risk stratify is The top 5 to 10% are your sickest patients, acute issues happening. You have to see them. No, nothing you can do about it.
Okay.
The next 20% patients are those with a lot of problems, sick patients. Anytime they can turn into the sickest.
Right.
So you have to make sure you see them every 3-4 months. You have to stay in touch with them. And then the next 60 to 70% have one problem, hypertension or hyperlipidemia, or they just need a regular check. Those, I think you can see them maybe once every 2 years or once a year. The rest of the time, any minor issues can be handled on telemedicine. That's my opinion. I think that was something I had read in a study about a couple of years ago. I think Barwick and Nolan had written some stuff on when you focus on quality of care on a population level, the cost of medicine will come down. So there, obviously, you'll have to risk stratify. So there is some scientific basis to it. So the sicker patients we should see, and the healthier patients we can handle on telemedicine.
And what about the follow-up patients? So like, I understand the first visit you can have in person. Do you think the entire follow-up calls, like whether it's any kind of specialty, are going to go over telemedicine? 99214, 99213.
Yeah,
that's what people are billing right now.
I think you can do a lot of these things via telemedicine. We'll have to figure out a balance, because a lot of my patients don't have access to it. Right.
And that's a big thing, because when we were setting up telemedicine for some of the doctors, you said like FaceTime is definitely the most easiest method.
Right.
But other than that, patients, even they were facing problems. I mean, we see, millions of users who are using WhatsApp and Facebook, and they all have video chat facility.
Right.
But when it comes to healthcare, I don't know, either they could not envision that this can be a tool to see a doctor, or what's the problem? Is it something to do with their mindset, or
no,
they are not prepared for it?
So even I had a hard time setting it up. I had to have someone come and set up the IT stuff on my computer.
And you are pretty IT savvy.
Right. So even on my phone, and so patients, 80-year-old, 90-year-old patients, going to be difficult unless I set up a service. We call them, we set it up on their phone, we try to help them. So we try to, as the younger population will be savvier, the older population, you have to handhold a lot. You'll have to find a balance.
So it would be a whole generational change if telemedicine has to be 100% or at least 80% globally acceptable. Then it has to be a generational change. Well, that was a fantastic conversation we had, Dr. Singh. I know you were busy. You have a lot of patients to be seen. So thank you very much for spending time.
Thank you, Kunal.
And we will have more sessions like that, but I hope this session will give some insights and ideas to our physicians and patients as well. Thank you very much again, and I'll be talking to you again. Thank you, Dr. Singh.
All right. Have a good one.